I'm going to record this webinar so folks can access this. Welcome. My name is Vanessa Adams. I'm the program coordinator for Kids Mental Health Pierce County, a coalition of agencies and providers here in Pierce County looking at supporting and streamlining behavioral health services and supports for school age youth. Here with Lisa Duke, very excited for our first official webinar that we have today. So this is the Understanding Children's Grief webinar. I am excited to just kick it over to Lisa. Let Lisa introduce herself. She is the program coordinator for Bridges, Center for Grieving Children, and really just diving in deeper, following up on our lunch and learn around what is Bridges, and now diving in a little bit further to just learn more about what Lisa's doing and how to support and understand children's grief. So Lisa.
Great, thanks Vanessa. Well, welcome. I look forward to interacting with you a little bit. I'll of course be doing a lot of the talking, but I look forward to any questions or thoughts you have in the chat that we can reflect on. So as Vanessa said, I am with Bridges Center for Grieving Children. I have been with Bridges for 12 years, working with the families and support groups that we offer since 2012. So next slide. So we are talking in this first webinar on children's grief, doing just kind of an overview, but also we'll do a little bit of a deeper dive in looking at methods of working with children and teens around grief. And so reason we're doing this is that children and teens are faced with the reality of death in their family, their neighborhood, and their communities at a greater rate than ever before. And so what we're hoping in this webinar is it'll provide some ways to equip you all as professionals in having a greater understanding and supporting children and teens in their experience with grief. So this first one, as I said, will be more just about children and grief. But then in the next one, the second webinar, we'll look at grief across development and how it shows up as children develop. And then on the third one, we will talk about how to talk with children and teens about grief and some interventions, some tools to use to help in that, working with youth in their exploring their grief. And then in the fourth one, we will talk about empowering the adults in the children's life and helping to give them some tools to support children who are grieving. So as I said, I've been with Bridges for 12 years. I'm the program coordinator currently. Hold on, back to the last slide real quick. There we go. Oh, next one, Vanessa. Thank you. That's perfect. So Bridges is Center for Grieving Children is a community program of Mary Bridge Children's Hospital. And we have been providing support groups to families for 35 years. We offer the groups to children anywhere from the ages of 4 to 18 in our in-person groups, and then the adults in their life. And families can join our groups if they've had the death of a parent or a child. And the groups provide a community for families to find connection with each other, to find others who understand the experience with the loss and the death in their lives. The mission of Bridges is that no child will grieve alone. So we do the in-person bereavement groups for those families twice a month. We have 2 different group nights that we do based on who in the family died and how the death occurred. And then we also once a month offer an anticipatory loss group. And that's our Discoveries program. And that is in person as well. And that's for the entire family when someone close to them has an illness. So it may be in the extended family. And it may be also in their community if it's impacting the family in that way. And on Discoveries Night, we partner as well we collaborate with our pediatric hematology, oncology clinic, social workers, and child life staff to provide a group for kids who have an illness at the same time that their siblings or the adults are in group with each other. This last year, we started, well, since COVID, it kind of got us launched in this direction, but we've started offering support to youth 18 to 25 years of age. And those are 8-week virtual sessions that we're offering for the young adults, either 2 a month with bereavement or once a month if it's an anticipatory loss situation for those youth. Yeah, next slide. So in the 35 years that Bridges has been offering the grief supports groups, we have offered support to over 10,000 individuals and from over 5,700 families. Currently, at any one time for Bridges, we're able to serve approximately 95 families in our grief support programs, and then about 20 families in our anticipatory loss support groups. And in this coming fall, in the fall of 2024, we will resume our grief support to with our satellite location so that we can reach families in the East Pierce community. So we will be at our Puyallup location, shared space out there in Puyallup, and that will be a closer location for some of our families in farther East Pierce County to reach those supports.
Lisa, we have a question that I was just going to have you answer live. There's a question that says parent or child, would that include loss of siblings? And I think this is for the grief groups, but also could be for anticipatory loss as well. Good question.
Yes. So it's the death of a parent or a sibling in our bereavement groups. And then it can be an illness of anyone in the family for our anticipatory loss groups.
Thank you.
Yeah. Yeah, next slide. So grief is a universal human experience, and we will all be impacted by grief at some point in our lives, but it is far too prevalent for children and youth. Go ahead with the next slide. So this is the childhood bereavement estimation model. Comes out of Judy's house, which is a children's grief center in Colorado, and they have the JAG Institute that functions as a research arm of what they provide, and they offer this nationally to anyone who would like that information about childhood bereavement and how children, a better understanding of the scope of what our youth are facing with grief. And so they created the childhood bereavement estimation model, and they break it out by states and as well as nationally, looking at what they estimate children will be facing with grief and loss. So in the next slide that we'll go to, we're looking at the childhood bereavement. Go ahead, Vanessa, with the next slide. Thank you. In the childhood bereavement estimation model nationally, they approximate that in the United States that an estimated 1 in 13, 5.3 million children will experience the death of a parent or a sibling by the age of 18. When I first started doing this work in 2012, at that time, this was before the childhood bereavement estimation model was created and this research was being done. But at that time, it was pretty widely accepted that 1 in 20 children would experience the death of a parent or sibling by the age of 18. And of course, this number that we're facing is greatly impacted by COVID and the experience of that. But there's also several other epidemics, as we know, that have gone on in our nation that impact this number of children impacted with this, facing the death of a parent or a sibling. And in this national number, they also break down, if you, in the resources is at the end of this PowerPoint for you to access this information as well, if it's helpful. But nationally, when working with the CDC, they've also put on this information. They put up that 27% of youth from the age of 0 to 24 will face 27% of them facing the death of a sibling or a parent is due to, well, the youth dying, 27% of them is from accidents and 10% from suicide. And as we go to the next slide, looking at Washington State, that the CPEM approximates 1 in 16 youth will face the death of a parent or sibling by the age of 18. However, one thing that's different with Washington State is that the rate of death, the cause of death for youth 0 to 24 is still 27% accidents in Washington State. But the rate of death by suicide in youth from the age of 0 to 24 is actually 15.7% versus the national percentage, which is 10%. So it's a higher rate in Washington State. And so what this does is it and go ahead to the next slide, Vanessa. It gives us a sense of what youth are facing in our state, in our country as a whole. And it also substantiates the need for support for children. And the research shows that bereaved children are at risk for disrupted development, and grief and trauma can lead to short and long-term difficulties, including academic performance, of course, mental health issues, and early mortality. And related to that, I mean, in conjunction with that, as many of you know well, the adverse childhood experiences and the measure of those, the ACE score for children and young adults, and the significance of that score. And of course, grief can be a significant factor in the adverse childhood experiences that can create real difficulties later for those children and youth. Okay, next slide. So children need to tell and retell their stories. By listening and re-listening to children, we give them a message that their experience is important. And by listening, we potentially address the sense of isolation and shame that can be associated with the death of someone close to them. We are not trying to fix or correct, but at Bridges and what we support in general in the support of youth who are grieving is that we're not trying to fix or correct. We're not trying to cure or even heal, but we are coming alongside the youth with the reality of what they're facing and hopefully helping them to normalize some of what they're experiencing with the powerlessness and the intensity and the difficulty with the grief. And I included this quote because I think it just really is helpful to remind us that it's not about having a cure for this, but there is power in coming alongside others, and expressing that care is really effective in supporting these youth. Okay, so this is something that we do with teens, particular, sometimes adults, and this is a point I'm going to ask for any of you who are willing and willing and open to the idea of participating. So grief is what we think and feel on the inside when we have a huge loss, when someone dies. One of the activities we do is that we have a worksheet that says if grief was a sound, a flavor, a color, an animal, a building, a song, what would it be? And one of the reasons for this is that it can help to engage without going directly to the thoughts and feelings that are difficult to express. It can provide a way to engage around the topic of grief. So if you jump to the next slide, Vanessa. So what I'm going to ask those of you who are willing to write in the chat from your own experience with grief. If grief was a sound, what would it be? And go ahead and put that in the chat, and Vanessa will help us kind of get a sense of people's response.
Seeing lots of things pop in here. Nails on a chalkboard, white noise, like from a noise machine, crashing plates, static, a loud gong sound, wind, howling wind, thunder, a storm, gut-wrenching howl, coyote howling, a gong, silence, screaming.
Yeah. Wow. One of the things I love about hearing just the responses is how varied it is, from silence to nails on a chalkboard to screaming, howling. Our experience with grief can be really varied, but your responses say a lot about how deep and how impactful grief can be. Thank you for doing that. So let's talk about, we're going to dive into a little bit more about just defining grief. So in our next slide. So grief is, again, the intense process of thoughts, feelings, and behaviors caused by a loss. And bereavement is a state of being. It's a state of experiencing the loss. And of course, many kinds of losses can bring about a state of bereavement. In mourning is the culturally patterned expression of the person's thoughts, feelings, and behaviors around the grief. So at Bridges, we tend to focus on the first two, that the grief has happened, that they are experiencing these feelings, these thoughts, behaviors, especially with children. Behaviors are big with grief. And the focus that we're hoping to help families with and provide a community for is the mourning. How can we support these families, these individuals, to get at the expression of those thoughts, feelings, and behaviors? Because in that expression, there is movement. There is some sense of being heard, being known. And of course, culturally patterned is really important. What that mourning looks like for that family, for that individual, where is the meaning for that family in that mourning, and how they get at their experience with the grief. Alan Wolfelt is a well-respected grief specialist in our country, and this quote really, I think, says it well, that only those who find a way to mourn find movement in their lives to live and to love fully again. And that is our hope, that movement can happen for the individual and families. So what we know, grief is a universal experience. Grief is a normal reaction to loss. There's no timeline on the grief. though it's probably one of the more frequent questions is, can you tell me how long this is going to feel this way? Can you tell me how long I'm going to experience this? We know that children grieve as they grow, and it can change. They can revisit grief in a different way as they grow. The entire family system is affected by grief. Individuals in the family may grieve very differently from each other, but the entire system is impacted. The goal is movement, again, based on the family and individual's readiness for movement and how they define movement, how they define strength for their family in that journey. And the family's culture, again, and how they find meaning is of primary importance in that journey. And then what we can expect in grieving children. So grief is isolating, especially for school-age kids. Thoughts and feelings associated with grief can overwhelm children and adolescents because of the intensity, the duration, and the unpredictability. Children will often act out their feelings. I mean, it's hard enough for adults to face those feelings and to share them. And often we get referrals to Bridges because children are having difficulty with behaviors in school or at home. And there's a grief aspect to their life. And so we get referrals often for that. Children may focus more on the secondary losses. So some of those secondary losses might be who will now make dinner for them because that person is no longer, alive. Who will take them to school? Who will read to them at night before they go to bed, potentially? So there are multiple secondary losses with the death in the family, and those that can be the primary focus for the child. Some of the other secondary losses may be financial. The death may have caused the need for a move, and so relocating to a brand new community. Another thing that we can expect with children is that they may have a short feeling span. So they may shift from feeling sad or feeling other painful feelings to shifting into play. And that's normal for children to do that. And then they may shift back to those painful feelings again. It can be puzzling for the parents or the adults in the child's life because of this short feeling span. It does not indicate a lack of grief on that child's part. It's really about their development and that need for play. And so a lot of what we'll do at Bridges is incorporating that play. So we're going to talk next about normal grief. Grief includes emotional, physical, social, psychological, and spiritual reactions. Most families, the majority of families that we see, will be able to adjust and return to some normal functioning, some daily tasks of life, particularly after the first couple of years. The goal is to return to those tasks of daily living. The first year may be the first year. Often families think it's going to be the hardest, and it is extremely difficult. The different anniversaries, the important dates, getting through them without that person or persons in their life. But the second year can be even more difficult, particularly initially, because adults in particular think, well, we made it through that first year. Okay, it's going to get better now, right? And the reality of the grief setting in, that this is what they're facing. It's not just getting through that first year, but this hole is here in their life now. And so it may take a couple years before they start to see that they're beginning to feel a little bit better. So the next slide, we'll talk about the symptoms of grief. And these are symptoms with normal grief. It is often isolating. There can be a loss of interest in normal activities. it can be that the person may want to stay super busy and not have downtime to reflect on the loss in their life, or they may not be able to engage in any of the social activities or many of them that they did before. There may be a questioning of beliefs, or there may be a more dogmatic view of their faith beliefs. There may be more fears. Children can fear the loss of another parent. That's really normal for children to experience that if they've had the death of one parent. They may have fears of going out, leaving home because their sibling was normal and seemed fine before they left the house and then didn't come back. So those fears, normalizing those fears, and helping the child helping to make a plan to help with those fears is something that we do with families. Um, some of what the psychological experiences of the grief can mimic the a learning disability, and so we try to help families look at how the child was functioning before the death. What were some of the concerns or challenges in that child's life? How are they showing up after the death? That can be helpful to decipher how much of this symptom is related to the grief and how much is related to challenges they had before the grief. The physical is, of course, really common with children: the stomach aches, the headaches, the restlessness, being really active, not being able to sit still, or not having much energy for anything at all. And so we can see in a lot of these that it can be the lack of or an intensity of. So the lack of appetite or wanting to eat an excess, the lack of sleep or getting too much sleep. And then the feelings. I mean, the variety of feelings. Sorry for the typos here, or the didn't catch this one, but a whole variety of feelings. Of course, sadness, anger, mad, happy, sad. You know, some of those. But the denial, the feeling withdrawn, the lack of feelings, the mood swings are really common. Some of the feelings that are difficult for adults to hear in their children might be guilt. And guilt is a really common feeling for children to experience when someone close to them has died. And one of the things that we really work with families on with this feeling, and even our facilitators that work in the group, sometimes we have to work with them on it too, is that we don't want to try to we're not trying to remove a child's feeling, even though we don't want, of course, a child to feel guilt or any of the other painful feelings. One, the reason we don't try and remove it is because it doesn't work to remove it. We can't remove feelings, though we wish we could. And two, it can, by adults trying to do that, can give a message that that feeling is unacceptable. And what the child may do then is avoid bringing that feeling up with the adults in their life. And what we're hoping is that the adults that care about these children can continue to create a space where the children feel accepted and feel that they can bring up any feelings or thoughts that they have, so that they have a way to have those be known and then get the support that they need with those feelings, those thoughts, those fears, those anxieties. So we encourage that. So the tasks of grieving are in our next slide. Is that the task of grieving is what we use at Bridges, that was developed by William Worden in the late 80s. And William Worden is a psychologist that was the co-principal on the Harvard Child Bereavement Study, which again was done in the late 80s. But it stands true today. It's been around a long time, but it really stands to be really a valuable way of thinking about how to get at the work of grieving. And I like that it's called the tasks of grieving, because it is work. It's a task imply a work, and it is work for these families and individuals. And So it's to accept that the person has died, to work through the pain of the feelings of that loss. 3 is to adjust to a new environment. And then 4 is to find ways to stay connected while moving forward. So these are not linear. They are not cyclical. I mean, they are cyclical in the sense that you person may be at one for a while and then jump to another and back and forth. And as most of us know with grief, that we can get hit suddenly by the experience of grief. And so they may be back at working through the pain of the loss, after they've already gone through that a while ago. Um, and hopefully they will at that point have some tools to then face that. So as we look at these a little bit more for children, with the next slide, to accept the person has died. So what we encourage with this, with children and youth, is to use honest language. Age appropriate descriptions of the death is really important. The child will often, particularly young children, may have magical thinking. And what children can tend to do is to think that in some ways, they're at fault for this death. And that's what we really want to avoid. And so using honest and direct language with children is really important and is really helpful in that accepting the reality of the death. Young children have a difficulty understanding the permanence of death, and that doesn't change usually until they reach closer to 9 years of age, and where they have a greater understanding of that permanence. So there may be a repeated needing to go over the story and the reality of the death with younger children in particular. Allow room for a child to teach, and what this means is really looking at what the child brings up. What are their thoughts? What are their questions? Because those questions, those wonderings that a child may have, really can give some idea, a window into what their thoughts and feelings are, particularly when they're not able to put words to those feelings or those thoughts. And so that can be really helpful. The second one in the next slide is the second task is to work through the pain of the loss. So the feelings of the loss, being open and honest as an adult, to be open and honest about the feelings that one has can really help a child to also can model that for the child. To be generous with listening and supportive language. The hope is to normalize the thoughts and feelings the child is going through, and that can communicate that a sense of being known and being seen. Allowing the child to fully experience the grief. So they may have a different explanation as they are going through grief. It's really common in our groups that we'll see younger kids they may not describe the death the same that their parents come into Bridges with a story of how the death occurred. And that's okay, because they're moving through this grief as they're developing. And then again, understanding the short feeling spans, and that it doesn't indicate that they're not grieving, but it's their need to play and work through those feelings. The third one in the next slide is adjusting to a new environment. Go ahead and jump to the next slide. Great. So adjusting to a new environment. We encourage getting back to regular routines. We will often have the question posed to us, do I send my child to school? Do I get them into school? And the answer is yes. However, they may need some protective measures. It may be helpful to work with the school social worker or school counselor to really find some ways for the child to gradually stay in school longer and longer days. And it may be a process of adjustment to that. And then responding honestly to the ongoing questions, setting goals together, but knowing it may take a while for one child versus another in the family. And there, of course, maybe some really different behaviors from one child to the next. If the encouraging the family to understand what the triggers might be for them or individual members in the family, and then being proactive to have a plan around that, to strategize around what those triggers might be. Um, and they may not know until they go through them, but then using that information as they go forward, because they will likely be facing it again. And then the fourth task is to find ways to connect while moving forward. So it's not forgetting, it's not um, it's not letting go of the person, but hopefully that they can stay connected to the person or persons while they move forward in life. The use of the person's name can be really important with the family. Culturally, that's important to consider. For some cultures, it may be a delay in the use of the name or the use of how the death occurred. So checking in with the family on that, but talking about memories with the person, finding ways to remember. Many families we work with will create areas of remembrance in their home. It may be pictures, it may be a semi like an altar or an area where they set aside for the family person to be remembered. And then have regular rituals that are meaningful to them in a way to hold on to that person as they continue to move forward. And we will look in the future webinars on development and what this can look like for different ages of children. But again, the emphasis on this is on what brings meaning to the family and to the individuals. So in the next slide, the prolonged grief disorder or complicated grief is a real reality for some families. And that's when a family can be stuck, or there can be real serious impairment emotionally, physically, socially, potentially occupationally for the adults in the family. And it impacts the relationships, career, family functioning, potentially sleep and health. And these areas are similar to normal grief, areas that can be impacted in normal grief. But again, it's in the severity, the sense of being stuck, that they're not able to find movement out of some of the challenges with the grief. And prolonged grief disorder really requires a clinical intervention and support. And a lot of what we do at Bridges is help families to find that hopefully fits what really helps them to fit what they're going through. And it can be complicated. Grief can come with families where there's been trauma before the death occurred. It may be that there were some aspects of the family environment that were unsafe or felt unsafe to the child, that can really limit the ability to cope with the death now. So we will, it may be financial stressors, it may be stigma around how the death occurred. And so what Bridges staff will do is work with the families, if this is the case, and try and set a screen for a more complicated grief and what they need. So in the next slide, collaboration with the community, as I was saying, is just really important and crucial in the support of grieving children. So that may be their faith community that's important to them, working with the school counselors or the school or the teacher, helping the teacher to know what the child has experienced and the counselor as well, so that they can partner with the family in making plans and what will help those children get through the school day, the school year, looking at their ethnic community and what's meaningful, important to them in their community. Potentially helping the family to advocate for with their medical providers. So if there are some physical concerns coming up with the grief for the children, helping them to work with their providers to decipher how much of this is grief and how much of it is something that physically can be addressed medically for those physical concerns. And then again, looking at, would it be helpful to work with the family to find individual counseling for the child, or work with the family on supporting them in conjunction of them being in the community of the support groups at Bridges. So our next slide is what support groups can offer. So, with 35 years ago, when Bridges chose to offer support groups, the choice was consciously made to do this support groups, to create the community of support versus primarily a clinical intervention. One, because again, that grief is a normal experience to this loss, that we're not trying to fix it. We're not trying to treat it, but we're offering a community and people to come together who have similar experiences. And it was chosen also because of this years ago, that trained volunteers with the clinical oversight of the Bridges staff are a good way to provide the facilitation of these groups. So support groups offer a caring community. They offer potentially a positive role models in each other, enhance their coping skills, definitely decrease the sense of isolation and that peer support. So what happens sometimes often in the adult groups is that they deal with their own grief as adults, but also how are others helping their children who are grieving, and really that sharing of knowledge. And hands down, what families tell us is that often it just happened this last Monday that families, the adults were saying in group that this was the last place they wanted to need to come in their life, but they're so thankful that there is a community they can come to. And that they came not so energized or thinking, well, I'll get there for my kids, but I'm not so sure I want the group. And then as they've moved through the group, they express a lot of gratitude for having that community that gets them, and that they also see the need of that support for them. So the next slide, it's a quote that we hold dear to the work that we do at Bridges, and that's, when we listen generously to people, they can hear the truth in themselves, often for the first time. So it really captures the work that we believe happens in the support that we're offering these families and individuals, that listening to them generously can give them the sense that they're being known and seen, and they can begin to think about what they need and want in this experience with their grief. Next slide. So just an example of some of the things that we hear from families, that their experience of group, that they feel safe. And I put this in partly because of the families and the individuals that a lot of you are working with aren't necessarily going to be in a group setting, but what we can all offer in our professions, in our interactions with children and youth that are experiencing grief, is that a lot of the same experience, just by that offering a support in place for them to express their experience with grief, can create a safe place. It can create a sense that they're not alone. It gives them a place to talk about some of their most difficult feelings and experiences. One of my favorites, that it was too long to put in here, is that two sisters, 7 and 9 years old, came back from Disneyland a couple years ago. We had this experience. The mom told us they came back from Disneyland, and the sisters said to the the mom that they weren't sure what was better, Disneyland or Bridges, which we love that. Though I think hands down Disneyland is probably better, but it's wonderful to think that these kids felt at home and safe and actually enjoyed themselves at Bridges. So the next slide talks about post-traumatic growth. And this is fortunately, having been in this work for 12 years, I've been able to see the reality of this with many of the families we've worked with, and that potential for growth after their traumatic experience with the death in their family. And it's not the denial of that stress that they've gone through, but the potential that adversity can bring changes and understandings of them, more of an understanding of themselves and of others in the world. And one of the ways that I've seen this at Camp Erin that we do, and also at Bridges, with teens. There can be a real empathy that they develop through this experience with the grief and the loss that they've had. We've seen it in even as young as 7 and 8 year olds, and it just can kind of blow us away to see the respect and the ability to listen and reflect back to each other at that young age with so much compassion and companionship. It can bring a greater appreciation of life, can change a sense of what their priorities are, where they want to invest time and energy and relationships and goals and their life. Can definitely bring a greater sense of personal strength, that they're getting through something they never imagined they would be able to when they first discovered, when they first learned of the death of their family member. And that sense of new possibilities or paths for their life. So next slide, one more quote for you, again from Alan Wolfelt, and that is that sorrow is an inseparable dimension of our human experience. We suffer after a loss because we're human, and in our suffering we're transformed. And that I really, from all that we see at Bridges, we see that transformation happen in a lot of families. We don't fix, we don't erase, and there may not even be a sense of healing completely anyway. But people do find a way to live again through others listening and caring about their experience with grief. We cannot face what we do not acknowledge. And by acknowledging to others what we are experiencing, what the thoughts and feelings are with the grief, can really provide an opportunity to find a way through it, I guess, and potentially be transformed by it. I have included in this next slide some resources for you. So, of course, Bridges is a resource. The website, there are some articles on there that may be helpful to individuals, families. There are some articles also about anticipatory loss that can be helpful. Aluna is the organization that does the Camp Erins around the country, the grief camps, and they have excellent resources on their website. This is the link for the childhood bereavement estimation model at Judy's house, which has a lot more information if you go to that link. Coalition to Support Grieving Students is a organization that just zeroes in on resources for schools and how to support students who are grieving. Of course, Kids Mental Health Pierce County has excellent resources and webinars and recorded for resources for our ongoing. And then the National Alliance for Children's Grief also has resources, and they also have NACG has a map of resources by state. If ever you're working with someone who is either moving or is calling from another state, there are a list of resources for children's grief by state as well. And then next slide has how to reach Bridges, our phone number, my email, and Matt Ledeen, our family support coordinator, his email. You can reach out at any time by email or calling us with questions or referrals or wonderings about. We field calls from across the region, first responder, chaplains to school counselors to providers' offices. So please reach out with any questions that you might have. And then questions.
Thank you, Lisa. Always grateful and always learning. There are a couple questions. One of them is, what is the wait time for getting a youth in the Bridges program?
Great. So that's a really good question. We welcome new families into our program in September, October, in January, and then again in March in our abbreviated summer groups. Right now, we are welcoming families into summer groups or fall groups, and so there would be that wait for to get into the actual in-person grief groups. It varies a little bit by who in the family died and how the death occurred as far as availability. And if they are in East Pierce County, we of course have more availability to start in the fall because we are starting up the satellite office in Puyallup in September of 2024. So the best thing to do would be to have families give us a call. What we'll do with them is we'll work with them of when would be a good time to start, when we would have availability potentially. We'll get resources out to them, and then we will follow them if they have a little bit of a time of wait before they can get into groups. We will follow them periodically to check in with them as well. Another resource is our Camp Erin. We still have some openings in our Camp Erin for June, so you can refer families with kids anywhere from 6 to 17 for Camp Erin, and hopefully we can get them in there as well. It's a free grief camp that we do out at Camp Seymour.
That is awesome. It looks like someone asked for links in the chat, and I will work on that. It says there was a question earlier that asked tips on language to use to explain suicide to young children. And I don't know if you have those or if you plan to cover some language specific things for age appropriate for development as we move forward. But anything around
Sure.
that?
We will talk about that further in the webinar about interventions and talking with children about grief. We do recommend that a child of any age be told that the person died by suicide. The details of that death, we do not recommend if the child is very young, if it's would be particularly upsetting, difficult for the child. So taking that judgment as far as the details of the death, but saying by suicide, we do recommend for several reasons. Children at young age will try to make sense of what does not make sense. And often the way they do that, if they're not given the information, is they will find some way that they're at fault for that. So we really recommend that the adult in their life can sit down with them and tell them how the death occurred. With social media the way it is now and how young children can get at social media, it can be very accessible information for the child. So we really recommend that they have adults that they can go to and talk about the experience with that this person died by suicide. And because we want them to be able to continue to go back again and again with questions. And if that adult is being a model of that, the child being able to talk about it, then it gives the child the message that they can talk about it and keep asking questions. So that's why we encourage it, even at a very young age, that child be told.
Thank you. I think that's very helpful. And as you described, you talked about that grief grows as you grow with your grief. And so the way that changes is Really important. Someone asked, you may touch on this in the next couple of sessions. However, what are your thoughts and experience with making teens go to grief counseling groups, even if they say they don't need it?
Good question. And we find that really common in the intake, that the teens will sit there and say, are you kidding me? This is the last thing I want to do. And we get it. We completely understand. You're sitting with strangers with this most difficult experience in their life. Why would they want to come? What we recommend to families is that they give it 3 tries, that they try it 3 times, and then they decide if it's for them or not. And many times, more times than not, the teens will be the ones that will get the family to the groups, because it is a community of peers who get it. And so it can be really powerful for them.
Thank you. I was able to just put the resources that were included in your resource list. I just got them put into the chat so folks can grab those from the chat. Also, can share things out if folks reach out to me. If you have follow-up questions, also really open to having questions posed to us ahead of time. I know that we have 3 more very exciting series, and so really looking forward to those next presentations, the next webinars. And if there are questions specifically that we could answer, that Lisa could answer, we would just love to hear those ahead of time. Happy to receive emails from folks to include what you're looking to learn as they make sense for these next few webinars. And I just want to again thank you, Lisa. Thank you, Kids Mental Health Pierce County team. Really grateful for this opportunity. This webinar will be recorded and uploaded to the website. If there are additional questions, you want to get our contact information, share with others, have the conversation moving forward. So thank you again, Lisa, for sharing your wisdom, your experience with our community. And again, just working together to support the youth in our community is going to take all of us. I loved that you highlighted in your slides that it's involving the community that's helpful and supportive, because it's all of us working together with one another to create a healthier community and healthier young folks. So just so grateful for you, Lisa, and all of your wisdom, and looking forward to our next webinar in April. Thank you so much.
Thank you.